Okay, today we are going to be introducing intramuscular injections, and I have a patient, Mr. Hoshi Ito, who right now is complaining of nausea, and he has an intramuscular injection of Tygan to treat his nausea. I've already seen him, and I know this because I've checked the MAR before. So I'm going to start by looking at my patient's chart. And I'm going to take the medication administration record out. Okay. And then I'm just going to check my orders, and I'm going to check the orders against my medication administration record. So I have the correct patient is Hoshi Ito, and the medical record number matches, date of birth 3/2/1950. And he was admitted to the telemetry unit with post-op wound dehiscence and tachycardia from an exploratory lap and appendectomy. He is allergic to morphine. I'm checking my allergy. And then I'm going to look here, and I can see that he does have Tygan 200 milligrams. I'm checking my medication administration record. Tygan 200 milligrams intramuscularly every 6 hours as needed for nausea and or vomiting. So my order matches my MAR, so I'm going, my medication administration record, so I'm going to put his hard chart away. And then I am going to start my planning, and what I need to know is what is Tygan for? What is the action of Tygan? What are side effects? Are there any nursing considerations I need to be thinking about? I want to know if it is safe to give my patient, and I also want to be thinking about the proper administration and dose ranges. And I will look up Tygan, and I see that it can be given intramuscularly, and 200 milligrams is a safe dose range for an adult patient. So then I'm going to also make sure that I'm thinking about anything I might need to teach my patient related to the Tygan and the intramuscular injection. And then I'm going to go ahead and gather my equipment. So I know I'm going to need my medication administration record. I need the cart where I have my medications. I'm going to need my alcohol wipes. I'm going to need 2x2s. And then for an intramuscular injection, I'm going to have to look for the correct size syringe and size needle. For needles, an intramuscular injection usually requires a 1 to 1.5 inch length needle, depending on what muscle group you're looking at and the size of the patient. And then probably a 3 milliliter syringe, unless I'm giving up to a volume of 4 mils, then I might need 5. But I'll look at my medication and see the amount that it is going to be required to be injected. So I'm going to take Mr. Hoshi's med box, okay, and I can see already the Tygan is 200 milligrams per 1 ml, so I'm going to use a 3 milliliter syringe. So I'm going to find my equipment. Okay, and here I have a 3 milliliter syringe, and it's a 22 gauge. So the gauge that I'm looking at for an intramuscular injection should be from 25 gauge to 20 gauge. So this is a 22 gauge, and it's 1.5 inches long. And I am going to go into Mr. Ito's ventral gluteal area, so 1.5 inches is a proper length for Mr. Ito. Okay, and this is not expired. So then I'm going to wash my hands, and I'll have gloves when I get in the room. And then I'm going to begin to prepare my medications. Okay, so I'm going to be doing my first check. This is Hoshi Ito, medical record number 589-135-1323, date of birth 3/2/1950, and he's allergic to morphine. And I'm giving Tygan, the correct drug, Tygan, correct dose is 200 milligrams, and here it says per 1 ml, so I'm going to be drawing up 1 ml intramuscularly, correct route, every 6 hours as needed for nausea. Now, he hasn't had this since midnight, and it's 9 o'clock in the morning, so it is safe to give because it's been longer than 6 hours. The expiration on my Tygan is 5/5/2015, and it does say it's for injection, which means it is safe to give intramuscularly. Okay, so then I am going to do my second check. This is Hoshi Ito, date of birth 3/2/1950, correct medical record number, so I have the correct patient. He's allergic to morphine. Tigan does not have any morphine or morphine derivatives in it. The correct drug is Tigan, dose 200 milligrams per 1 ml. I'm going to give 1 ml. Intramuscularly, it's an injectable form, every 6 hours, and it's safe to give because he has not had it since midnight, and it's 9 a.m. As needed, PRN for nausea, and he is nauseated right now, and this is not expired. Okay, so now I'm going to put my patient's drawer away. Just going to set it out of my way while I prepare. And I take my alcohol away, and I'm going to clean the top of the vial. And then I'm going to open my supplies and assemble my syringe and needle, keeping the hub sterile. Making sure it's nice and tight. Okay, and then I'm going to pull up, because I said it is 200 milligrams per 1 ml, I am going to pull up 1 milliliter of air. I'm going to take off my cap, and I'm going to inject the 1 milliliter of air into the vial, air into air. And then I'm going to turn over my vial, making sure that the needle is in the solution, otherwise I'll just be drawing up air. And I'm going to withdraw 1 milliliter of Tigan, which is 200 milligrams. I have a few air bubbles. Without contaminating the needle or the hub, I am going to get rid of the air, and I have exactly 1 milliliter of Tigan. Okay. One-handed scoop method, so that I do not stick myself and then only touch at the very edges of the syringe, so in case the needle goes through the cap. And now I'm going to be doing my last, third, and final check. And again, this is Hoshi Ito, medical record number 589-135-1323, his date of birth 3/2/1950. He's allergic to morphine. I'm not giving him morphine or morphine derivatives. The drug is Tigan, and it is 200 milligrams in 1 ml. I am giving 1 ml or 200 milligrams. Intramuscularly, I have the correct equipment. Every 6 hours, he last received it at midnight. It's 9 o'clock now, so it's safe to give. As needed for nausea, and he is nauseated, and my injectable form of my drug is not expired. So I'm going to put my vial away and lock up my med cart. Okay. And then I am going to take my alcohol wipes, a 2x2. I might want to take a Band-Aid, and my medication. I'm going to clean up the cart, get rid of the garbage. And I'm going to go into Mr. Ito's room. Now before I progress, I just wanted to, I know I'm going to the ventrogluteal area, but I am going to tell you the other intramuscular sites. There's the deltoid, and the deltoid, you find the landmarks, which is the acromion process. You take your 3 fingers and place them over the, below the acromion process, and then where you're going to go is you can actually make a V, mid-axillary line, and I can't push my V down, but you're going to inject right into that V, or you can put your 3 or 4 fingers, lift that 4th finger, and you're going to go right into the area under that 4th finger mid-axillary line. To get the vastus lateralis, you're going to divide the thigh into 3 parts, so you have the inner, the upper, and the outer third. You're going to find your vastus lateralis by taking from the trochanter to the knee, dividing that outer aspect into thirds, and you're going to take the outer middle third, and you're going to find your vastus lateralis muscle there. And then the ventral gluteal, I will show you on Mr. Ito. Okay. So I take my medications, and knock, 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 knock. And I'm providing for privacy. Good morning. It's Kim again. I'm back with your nausea medication. Wash my hands. I just need to identify you, Mr. Ito. Okay, can you tell me your name? Hoshi Ito. Good. And your date of birth? 3/20/1950. Good. Okay, I'm just going to check your medical record number here. And they match. And what are you allergic to, Mr. Ito? Morphine. Okay, I'm not giving you morphine. I have your medication, which is the Tygan, and it's to prevent you from having further nausea. It should give you some relief. And I saw that the last place that you received this was in your right ventral gluteal area. So I'm going to go to the left ventral gluteal muscle. So I'm going to go towards your buttocks here, and I'm going to have to go on the other side because I'm going to be using my right hand for the landmark for the left ventral gluteal region. Okay. Okay. Do you have any questions for me before I start? No. Just make it quick. Okay, I'll try. Okay, so I'm going to have you turn to your side if you can. Okay, so he's turning. And I'm going to get my gloves. Okay, and then I'm just going to expose your gluteal region. This shouldn't be set in the bed. I should be actually having a bedside table to set this in. Okay. Okay, and then I'm going to just find the landmarks, Mr. Ito. So what I'm looking for is I'm pointing my thumb to the groin. I'm placing my palm on the greater trochanter, thumb to the groin, and then I am taking my pointer finger and putting it on the anterior superior iliac spine, and my middle finger is pointing towards the iliac crest. And in this V is where I am going to be doing my injection. Okay? So I'm going to take my alcohol wipe and clean that area. And then I'm going to leave that alcohol wipe just to point, and I'll replace it with my 2x2 so I have that pointing right to where my injection site is going to be. I'm going to pull off the cap and throw it away. I'm going to use Z-Track, so I'm going to pull the skin to the side with my outer aspect of my hand. Okay, you're going to feel a pinch now, Mr. Ito. 90-degree darting angle. Okay, stabilize it with my left hand. Aspirate. 1, 2, 3, 4, 5. I didn't receive blood, so I'm going to inject at a rate of 10 seconds per mil. Okay, and then I'm going to move my hand out of the way, take the needle out, and release his skin, the safety, and cover the site. You did great, Mr. Ito. Okay. All right, I'm just going to cover your hip up again here. I want to get rid of this right away and put it in the needle box. In the sharps container. Okay, you did really well, Mr. Ito. Can I help you with anything else? How about, should I reposition you? Would you like your head up a little? Oh, it sounds good. Okay. Very good. And I'm going to make sure your bed is in lowest position. You have your side rails up. I want to give you your call light. Okay, so that's there. The wheels are locked. I'm going to clean up my mess, and then I am going to make sure that that's working. So I'll be back to check on you in about a half hour, okay? And if you have any problems or it's really bothering you or anything else, put your call light on and let me know, okay? Wash my hands. Open the curtain again, and then what I'm going to document is that I gave Mr. Hoshi Ito Tygan 200 milligrams at 9 a.m. It was IM, so I'm going to chart that it was given LVG to the left ventral gluteal region, and then sign that with my initials, and then sign my initials and my signature on the signature sheet. And then I'm going to go back and check on Mr. Ito to see if he had relief of the nausea, and also just to look at that site to make sure that there's no complications at the site. That's it.